Hello, my name is Marley. I'm a midwife and a mother of 5, and I'm going to be talking to you today about the different stages of labour. If you want to learn more about pregnancy, birth and the postnatal period, looking after a newborn baby, then please do feel free to check out my Instagram page at Midwife Marley. So if you're a first time mum, you might be a little bit apprehensive, not sure what to expect. You may well have heard various stories from other people. So I'm just going to break it down to you in 3 different sections. So when we talk about the stages of labour, there's actually 3 main stages. The first stage is called the first stage of labour, which is where you're having contractions. The second stage is where you are pushing your baby out. And the third stage is the birth of the placenta. So the first stage of labour is actually usually the longest stage. And we kind of split the first stage of labour up into 2 different sections or 2 different segments. So we have what we call really early labour or the latent phase, and then we have active labour. So let me just break down early labour for you first. When your body decides that now is time for the baby to be born, it goes through a number of changes, hormonal changes, physical changes as well, and then the uterus will start to contract. Now, popular contrary belief, this doesn't usually happen really quickly. You may well have seen on TV where the lady's walking around and all of a sudden she drops everything and she starts screaming, "Oh my gosh, I'm in labour." Now, for most women, that doesn't happen. Occasionally you get the odd case where that does happen. But for most people, it's actually a slow building process. So what the uterus has to do, the uterus has to work to soften and dilate your cervix to open it up so that baby can be born. Now the uterus is basically a muscle and it comes in 2 segments. You have the upper segment of the uterus and you have the lower segment. Now both segments of the uterus need to be working together to contract, to dilate the cervix and so the baby can come through. Now often in the very early stages of labour, you may well have irregular contractions, so they may well be coming every 15 minutes or every 20 minutes or every 10 minutes, on and off, perhaps throughout the day. Sometimes it goes on for a couple of days. And then eventually, all that hard work that your uterus has been doing will manage to get your cervix to around 4 centimetres dilated, which is about, not very big, it's about that big. Once you are at that point and you're having more regular contractions, then you go into what we call established labour. So it can take a little bit of time to get up to that point, but then when you're at that point, usually labour tends to be a lot faster from there. So in the early stages, your cervix is basically going from being a long sort of thin, hard tube to being very short, thin and effaced. So it starts to shorten and open up. Now what I always say to people who are in the early stages of labour and things can be taking a little bit of time is to make sure you keep hydrated. So don't dehydrate yourself, make sure you have plenty of fluids. Make sure you have some snacks on board as well, because you need your energy, especially when we get to the second stage of labour. And to keep mobile, to keep upright, to keep moving around, find some distractions. So that could be in the form of trying to watch something on TV, maybe a comedy, even go for a little walk if you can. Just kind of keep yourself moving, but listen to your body too. If you're feeling absolutely exhausted, then yes, absolutely have a little rest and have a sleep. So you may find that after a little while, the contractions that you've been having irregularly become a lot more regular. So rather than being spaced out every 15-20 minutes, they start to get much closer together, and they can get to the point where they're coming every 4 minutes or so. And they're very strong, and they're lasting up to between 50 seconds and a minute. Now, if that's been going on for an hour or so, then it could be a sign that you're actually now in established labour. And at that point, I would say to women to call their care provider and get some advice from them, because they would probably say to you, "We'll come in and we'll examine you and we'll assess you and see what is happening from there." When you are assessed and you are in the active stage of labour, as I said before, things should go a lot quicker than being in the very early part of the first stage of labour. So it gets a little bit confusing, because even though there are 3 stages of labour, the first stage usually kind of comes in 2 parts for most people. So when you're in established labour, you will be in the hospital or the birth centre, or perhaps you would have called your midwife over if you're having a home birth, and things may be quite intense. You may have spoken about what type of pain relief you want to have. If you want to have any, you may have studied some hypnobirthing, so you may be using hypnobirthing techniques to help you get through. You'll then talk to your midwife about your birth plan and what you are hoping for, whether you wanted to have a water birth, whether you want to have an epidural. You'll discuss all your options with the midwife prior to you going into labour, but now is the time to actually talk to your midwife about your birth plan and what your wants and what your wishes are. There will become a point when you're in the active stage of labour that you enter what we call the transition stage. So this is when your cervix is now approaching around 10 centimetres dilated. The baby's head is coming right down through your pelvis and through to the birth canal, and you may start to feel some urges and pressure down there. So that's basically the baby's head trying to come out. During this stage, many people will describe a sense of feeling a bit fearful sometimes, a bit worried, a bit anxious. Many people will say, I want to go home, I can't do this anymore, I can't take it. If you've planned on having as little medical pain relief as possible, you may well start saying, I want an epidural. But usually this transitional phase only lasts for anywhere between 5 minutes and half an hour or so. And it's basically your body saying, right, baby is now ready to come out. So we start to enter the second stage of labour. So when you are fully dilated and the head is low, then we call it the second stage of labour. Now, hopefully by this stage, you will be getting some involuntary urges to bear down and birth your baby. If you have had an epidural, then sometimes you don't always feel this sensation, and often your midwife or your care provider will need to tell you when to push because you won't be able to feel the contractions that you're actually having, and you won't be able to feel that urge to bear down. But if you haven't had an epidural, then your body should take over and you should be having that urge to push. So the second stage is fully dilated and birthing your baby. Once the baby is born, then we wait for the placenta. So we then go into the third stage of labour. There are two different ways to manage the third stage. So you can either have an injection, which is popped into the top of your leg, the top of your thigh, near your bum. And it's an oxytocic drug that basically makes your uterus contract again and helps to expel the placenta. Women who choose to have that, they often say that the placenta comes out within sort of 10 minutes or so. But some women don't want to have the injection, they opt not to have it, and the placenta often just comes out on its own. This again can take anywhere from 5 minutes right up to half an hour or a little bit longer sometimes, because you're not having that active management. So you can have active management, which is the injection, or you can choose not to have the injection, which is what we call a physiological third stage, where the body just expels the placenta all by itself. If you are a high risk case, so perhaps you are at high risk for having a postpartum hemorrhage for whatever reason, then it may well be recommended that you do have that drug just to help keep your uterus nice and contracted after you've birthed the placenta, just to minimise your risk of having a postpartum bleed. So once the placenta comes out, and it's usually a lot easier than giving birth to your baby because there isn't any bony parts in the placenta. It's just like imagine like a steak. It's like a big lump of steak. It's an amazing thing. It's an amazing organ, but it's like a big lump of flesh, and it's usually quite easy to birth the placenta. Once that's out, then your midwife will check you over down below just to make sure that there aren't any tears. She'll also check the placenta to make sure it's complete, because we don't want anything being left inside the uterus. So during this time, you'll probably be having a bit of skin to skin with your baby, so your baby will be lying on your chest. We also talk about delayed cord clamping as well, which is where when the baby is born, the cord isn't cut straight away. You allow the blood that is already in the cord and in the placenta to still flow through to your baby until the cord has stopped pulsating, and then we usually recommend it is cut. So that's something that you can always talk to your midwife about as well. And then when the placenta is delivered, then your midwife will check you over just to see if there are any tears that need to be sutured. So throughout this whole time, we do recommend that you have a bit of skin to skin with your baby. That helps to promote bonding and oxytocin. Oxytocin is also the hormone that keeps your uterus nice and contracted, and it helps to expel the placenta, and it also prevents any postpartum bleeding. So those are the 3 stages of labour in a nutshell. I made it sound really easy, didn't I? Well, actually, labour and birth is different for every single person who has a baby. And the best thing that you can do is make sure that you are full of knowledge, that you're informed, that you've got the right support from your care team as well, so that you can make the best informed decision for you and for your baby. Now, if you're interested in learning about hypnobirthing, please feel free to check out my website, midwifemarley.com, and also I remind you of my socials, so at Midwife Marley on Instagram, and also the Birth Coach on Facebook. And you can find out about the hypnobirthing program that I have to offer that can help some mums remain calm, focused and confident throughout their birth.